Okay. Okay. So the last thing we did was, yes, okay. We were discussing coronary heart disease, and we were discussing the factors which cause the coronary heart disease and how to prevent them. Right? Okay. So then I left the treatment. I said because treatment needs detailed discussion. So we will discuss the treatment later. Now, before I start with the treatment, let me emphasize on the fact, and also take out page number 111 of your biology book. Okay, so we are discussing the treatment of coronary heart disease. Okay, so the best treatment and the best way of combating this coronary heart disease is to change your lifestyle and to make it healthier. By that, I mean that we should eat healthy. In the last class, we discussed the harmful effects of LDL and salt. So our food should be healthy, rich in fiber, balanced diet, should have all the minerals and nutrients, and should be devoid of LDL and salt, right? And we should exercise, we should be active, we should lead a healthy lifestyle. Now, after saying all of that, people who do go into coronary heart disease, what should we do with them? Now, the first step that we will take will be to treat it with drugs. Okay, I have like shortened all the points that are mentioned in your book in this form with drugs. Now, there are three sorts of drugs, three types of drugs that are given to a coronary heart patient. Number one is a statin. We discussed in the last class that statins are a group of drugs which inhibit an enzyme that synthesizes cholesterol. Remember, cholesterol comes into our body via two sources, from two sources. One, our liver synthesizes it. Second, we get it in our diet, from our diet. Now, why does the liver synthesize it? I discussed in the last class because cholesterol is not all bad. Small amounts of cholesterol are required by our body because many of the structures of our body need cholesterol for their synthesis, such as cell membranes, right? Now, statins, they inhibit the enzyme which is responsible for the synthesis of cholesterol in the liver, and therefore leads to decreased level of cholesterol in the blood. So that is one drug that we use. The second is drugs that decrease the blood pressure by dilating the blood vessels. So as we dilate the blood vessels, the lumen of the blood vessels get bigger, and therefore the blood can flow easily, and that reduces the blood pressure. This group of drug is basically called antihypertensives. You don't have to know this name, but this is what they are commonly referred to as in the medical world. Now, the third class of drugs is aspirin. Yes. How aspirins work is that they do not allow the platelets to aggregate. Remember, blood clots are formed by platelets. I think we did that in grade 7, a little bit of it. When a blood vessel is ruptured and when there is blood loss, platelets detect it, and platelets aggregate. Aggregate meaning they group together, they cluster together in order to form a clot or a plug which will prevent further loss of blood, right? So aspirin inhibits that. Aspirin inhibits the platelets from getting together or sticking together. Okay, that's how the aspirins work. Okay, so they decrease the blood clot, and through this action, they also thin out the blood. By thinning out the blood, what I mean is that the blood's viscosity, viscosity meaning that it is less thick, it is thin. Okay, now these drug therapies are not for weeks or months, but they're for years and years and years. These drug therapies require a long period of time. So the person is dependent upon these drugs for almost the rest of his or her life. So it is better to change your lifestyle instead. rather than depending upon these drugs, and these drugs have their own side effects as well. So this is not a very healthy way of, you know, dealing with the problem. Okay, and if the person's lifestyle is so unhealthy that despite all these drugs, he's still having coronary heart disease because his lifestyle is so unhealthy that even these drugs fail to help him out. Now, for those, or because of some other underlying conditions such as advanced age or, you know, some other problems, the drugs were not successful in curing that person, then we will have to go to surgical treatment. Okay, these are some of the surgical treatments that are mentioned in your book and that I'm going to discuss with you. First of all, coronary bypass. Now, what is a coronary bypass? Let me get you an image. I'm sharing my screen with you guys. Okay. Okay. Wait, bear with me. Here, this is bypass. Now, the part of the coronary artery which is enclosed within this rectangle is the one which has been blocked. Okay, maybe by a thrombus. Now, what is a thrombus? Thrombus is a blood clot. The medical term for blood clot is thrombus, and this term is also used in your book, so that's why I'm introducing this term to you. And the condition is called thrombosis, and when it takes place within coronary arteries, it is called coronary thrombosis. Okay, now this part which they have encircled in a rectangle is the one which has been blocked by, okay, in the inlet you can see that they have shown a closer look of this part of the coronary artery. It has been narrowed down. It has been narrowed down by the deposition of atheroma. Atheroma is that plaque we were talking about in our last class. So that plaque deposition narrowed this vessel down here. Okay. Now the purple colored tissue is the one that was getting its blood supply through this coronary artery which got blocked, right? So now its oxygen supply is blocked and therefore it has gone purplish. Why? Because of accumulation of carbon dioxide, and it has accumulation of deoxygenated blood, which is high in carbon dioxide and low in oxygen. So they are deprived of oxygen. Okay, so that's a problem. This will lead to ischemia. Now, coronary bypass is when vessel from some other part of the body is taken out. Remember, we have collateral arteries. I was talking about collateral arteries. So there are many throughout our body. So one of those arteries is taken because, you know, the other artery is doing its job. So it's safe to take out one of those arteries from some other tissue, such as some other, you know, from the leg or from other part of the body. We can take a vessel out, and then can you see the vessel which is labeled as bypass graft? That's the vessel which is connecting the aorta. This big arch, this red colored arch is the aorta. So this graft is a newly implanted vessel. Okay, graft is a term which is used for a newly implanted tissue, basically. So this vessel is connecting the aorta with that part of the coronary artery which is below the stenosed part or below the affected part, so that the blood can now be directly diverted from the aorta to those coronary vessels which will supply that part of the tissue which was initially deoxygenated. Can you see? This tissue was initially deoxygenated, but now the blood supply has been revived because of this graft, because this graft like sort of provides a bypass. So now the blood can be diverted and it has bypassed that problem area that was blocked. It is bypassing that problem area and is now reaching the tissue which was suffering from ischemia, which was not getting oxygen. So now you can see the color of the tissue is back to pink again. Okay, so I hope you understood this bypass surgery. Okay, The second surgical method your book is talking about is a stent, mesh tube. Now, what is that? Mesh means network, network. Jali, Urdu mein kehte hain jali, mesh tube. So you can see that this thing, which they have implanted within the vessel, is looking like a mesh, looking like a jali, right? Now, and you can also see the plaque, the yellow part at the sides, that is plaque. So the mesh tube is pressing that plaque sideways and opening the vessel, and therefore allowing the red blood cells to pass through it, right? So this is how a blocked artery is opened with the help of a mesh tube. By the way, this mesh tube is called stent. Okay, so you must have heard people getting a stent. So this is how a stent looks like. Okay, I hope this is easy. Then angioplasty. Now, angioplasty is sort of a catheter which has balloon attached to it, and that balloon is deflated. Deflated means like it has nothing in it when it is inserted into the vessel, into the problem vessel, into the vessel which is stenosed due to plaque. Now, catheter is just this instrument which they are using. Catheter is an instrument which is inserted into the body parts for different purposes. So here we are trying to insert this balloon. Now, this balloon is filled with some sort of a fluid. Okay, it is after the catheter is inserted into the problem area, then the fluid is inserted into the balloon and the balloon inflates. And when it inflates, meaning it swells or expands due to the fluid, it presses onto the plaque. Okay, you can see the plaque being pressed. And so it opens the lumen of the artery, allowing the blood to flow normally or smoothly. This is called angioplasty. This is angioplasty. Okay, they have also shown you the cross section on the right hand side. Okay, how this vessel looks in the cross section. So you can see the lumen of the artery is narrowed due to the plaque at the top. Then we inserted the catheter, and then the balloon was inflated by the fluid. And then after the plaque has been pressed and the lumen of the artery has been opened, the balloon is removed. And so we have a better and a widened artery through which the blood flow has improved. Right. So these were the 3 surgical treatments of coronary heart disease. Now the last resort is okay, this is another picture that I got of angioplasty. Okay, again, you can see the plaque narrowing down the lumen. Again, the balloon catheter is inserted. It has pressed the plaque back, okay, along the walls. Okay, by the way, if the person continues with his unhealthy lifestyle despite all these surgical interventions, then this plaque can relapse. Relapse meaning it can come back again, blocking the artery, blocking the vessel. So that person might have problems again. So it is always best to change your lifestyle, because these interventions are not the permanent solution. Okay, the last is heart transplant. Okay, heart transplant is the worst and is the most complicated, because it is one whole complicated organ being transferred or transplanted from one body to the other. Now, our immune system will not accept any other body tissue except for our own, okay? Because our immune cells detect those tissue cells as foreign. So they start producing antibodies against them. And that will lead to rejection of that organ, because the antibodies will cause damage to that tissue. And so that tissue might be rejected. So people who undergo heart transplant are on immune suppressant drugs for the rest of their lives. Why? Because we want to suppress their immune system so that they do not reject the heart, so that the heart can keep working. But what are the side effects? What might be the side effects of suppressing someone's immune system? Immune system basically is defense against diseases and germs. And so that person will be exposed to all the diseases and germs because his immune system is suppressed. So he might get sick of other diseases. So yeah, he got the heart, but he has other problems now. So that is why changing lifestyle is the best. These are not preferred solutions. Okay, so that was all about the treatment of coronary heart disease. I think I have addressed all the topics, all the points that were mentioned in your book. If there is any question, I'm coming back to you, then I will take questions from you guys. And then we will start with heartbeat. Okay, let me see. Yes, the yellow part is fat. Okay, yes, blood clotting helps in cuts, that's right. Okay, that's a very good question, Saad Amir. How do doctors decide whether to do angioplasty or the mesh-up tube? What happens to the plaque? Does it remain there or is it taken out? The plaque is, no, I don't think plaque is taken out. You know, you can see in these pictures, they have only compressed them down next to the wall, but they have not removed it. Absolutely. Okay, what is coronary thrombosis? Blood clot blocking one of the coronary vessels. That's coronary thrombosis. Basically, thrombus is a clot. Okay, so thrombosis is the whole disease is called thrombosis, where the blood clot blocks one of the coronary vessels. Okay, now how do doctors decide? That is a very good, interesting question. I don't know. That's, I think, advanced. That's medicine. It depends upon the patient's history and what procedure would best suit that particular patient. Okay, so Ibrahim, what is jali fake? What is jali fake? In angioplasty, the blood vessel is blocked by the instruments. So where does the blood go? No, the blood vessel is not blocked by the instruments. The blood vessel is opened by the instrument so that the blood can go easily. Yeah, okay, go and ask your dad. Good job. Okay, so now let's move on to heartbeat. If there is any question, please use the chat window, and please do not use the chat window for unnecessary comments. Okay, I did not like this jali fake comment. Okay, I did not like it. Okay, please do not post any unnecessary comment in the chat window. Okay, I will have to remove that person. Okay, okay, now page number is 112. Page number is 112 of why isn't the plaque taken out? Yeah, because it is too complicated. The surgery would get too complicated. Okay, heartbeat. Okay, let's move on to heartbeat. The normal heartbeat in an adult. Ibrahim, the instruments are within the blood vessels only during the surgery. Then the instrument is removed. Okay, the mesh stays there, but as you can see in the picture, I showed you the picture. The mesh is increasing the space within the blood vessels so that the blood can pass easily. Okay. Okay. Now, the normal heart rate of a person, of an adult, healthy person, is the normal heart rate of a healthy adult person is 60 to 75 beats per minute at rest. Okay, these are all the points, important points that were there in your book. Stethoscope is that instrument which is used to hear the heartbeat. Okay, if you guys, as you just mentioned, my dad is a cardiologist. If your parents are doctors, then maybe you have already seen a stethoscope. But for those who haven't, I'm sharing the picture of a stethoscope. Okay, let me show you. Okay, okay, another thing. No, let me show you the stethoscope first or I'll forget. You know, the problem with me is that I forget many of the points. So you guys can help me with that. This is what a stethoscope looks like. You must have seen it, you know, doctors wearing it. This is the stethoscope which is used to hear the heartbeat of patients or of anybody. You can even hear your own if you have got one. Okay. Now, one complete heartbeat sounds like a lub dub. Okay. a lub-dub. I wish I could make you hear, but I don't have audio for that, okay? Now, as you can see, one complete heartbeat is a lub-dub, lub-dub. Now, lub is what? It is the closure of, the atrioventricular valves. Lub, now I told you we discussed the valves, remember? Now, there are valves between the atria and the ventricle, right? Between the atria and the ventricle. There are two. On the left side is mitral, MLTR, remember? Mitral on the left side and tricuspid on the right side. So they are atrioventricular. The reason why they are called atrioventricular is because they are between the atria and the ventricles. So the first sound lub is due to the closure of the atrioventricular valves. Dub is the closure of semilunar valves. And what were semilunar valves? What were semilunar valves? What are semilunar valves? Can anybody answer me in the chat window? What are semilunar valves? Yes, semilunar, yes, means half moon. They look like half moons, but where are they found? In which vessels? Yes, in the pulmonary and aorta. In the pulmonary artery and aorta. Good job. Yes, not pulmonary vein, pulmonary artery. Okay, Ibrahim, pulmonary artery, not vein. Okay, aorta and pulmonary artery. So I told you, when the blood is moving from atria to ventricle, then we have valves. And then when the blood is squeezed out of the heart, then we have valves, okay, in the pulmonary artery and the aorta, okay, from the heart. Okay, so now, what is a pulse? What is the pulse? Pulse is one complete cycle of contraction and relaxation. Relaxation is when the vessels expand due to the blood being pumped into them by the contraction of the heart. When the heart contracts, the blood is pushed out of the heart into the arteries, into the vessels, and as a result of that, the arteries expand or relax. Okay, so one pulse is one complete cycle of contraction and relaxation of arterial wall muscle. Okay, and so each heart contraction will give you one pulse from one contraction of heart. One contraction of heart will give you one pulse. That's why it is easier for the doctors to just feel for your pulse, measure your pulse rate, count the number of pulse in 15 seconds or half a minute or one complete minute, and that's how they get an idea of your pulse rate. Now, pulse rate is a very good indicator of the well-being of a person. When a person is feverish, the pulse rate will increase. So if the pulse rate is increased, we know that the body is not doing well. We need to do something about it. Now, what are the sites of feeling pulse? Any site where the artery is close to the skin. Okay, common places are wrist and side of big tendons in the neck. I got a picture for you, this one. Look at this. This is how you feel the pulse on the wrist or in your neck, right next to the tendons. You know, when you turn your neck, when you move your head, there are tendons which harden in your neck. I don't know if you're getting what I'm saying. So just on the inner side of those tendons. And remember, another thing, very important, when you are feeling the pulse, make sure the muscles are relaxed. Make sure the muscles are relaxed, because if the muscles are contracted, then the muscles harden. And when the muscles harden, they do not allow for the feeling of the pulse. Then feeling the pulse would be harder because the muscles are contracted and they are hard. But when the muscles are relaxed, they are soft. So you can feel the underlying pulsation of the artery. Okay, what I mean to say is this. I can show you the wrist thing. I can show you the wrist thing. You cannot see my screen? Oh, I did not share my screen. Oh, sorry. Okay, let me show you. Yeah, it was the picture I was talking about. This is how you feel the pulse on the wrist, and that is how you feel the pulse in the neck. Okay, right next to the big tendons. You must be able to see the shiny big tendon of this person in the picture. Okay, when you move your neck to one side, or when you move your head to one side, you can feel this tendon. You can feel this tendon. So yeah, you can feel the tendon, but remember the muscles should be relaxed, because if they harden, if they contract, then they will not allow for the feeling of the pulse. Okay. Okay, now I am showing you, hold this camera for me. Okay, like for example, this is my wrist. If my wrist is contracted like this, it will be difficult for anybody to feel my pulse. So I have to relax. And this flexed. Why flexed? Why flex? Because I don't want this muscle to contract. This should be relaxed. If this is relaxed, then it will be easier. Relax, absolutely relax. Then it is easier to feel the pulse. You can do it on your own wrist. Okay, and you will feel, and you will also realize that when your hands are contracted or tense, then the feeling of the pulse fades away. You cannot feel. Why? Because the muscles harden. Okay, so that was that. Okay, now let's talk about ECG. Let's talk about ECG. Let me have a look at the chat window. Did anybody ask any questions? No pictures of pulse, but I can't feel in neck. Pulse rate increases with heart rate. Yes, because you see, each heart contraction is causing one pulse. So as the heart rate increases, the pulse rate also increases. Okay. Life, 999 life. You can ask your dad, right? I'm just kidding. Okay, ECG stands for electrocardiograph. Okay, electrocardiograph. It is written in your book, just above the picture, this picture. Let me share my video with you. Here. Okay. He is in hospital, by the way. Oh, okay. Okay, electrocardiograph. One pulse meaning the complete lub-dub of the heart. No. One pulse meaning one contraction. One contraction. Okay, so I think it's either what was it? Yeah, okay. So one lub of the heart, I think. One lub of the heart, if I'm not mistaken. Okay, now these are electrodes, and they detect the electrical activity in the heart. Okay, they are electrodes and they detect the electrical activity of the heart. You don't need to go into the details of how this works. Okay, that's not in your course. Okay, but you should know their basic function. They detect the electrical activity of the heart. Now, what do I mean by electrical activity of the heart? Of course, any muscle contraction is in response to nervous stimulation. Without nervous stimulation, muscles will not contract. So same is the case with heart. The heart will contracts in response to nervous stimulation from the brain through a specialized tissue, which is in the walls of the right atrium, which is called the Sinoatrial Node, or pacemaker in common language. In easy language, it's called pacemaker. Okay, and its exact medical term, anatomical name is Sinoatrial Node. It is a specialized tissue. It is muscle as well as nervous tissue combined together. It is a specialized tissue. You don't have to go into the details, but it is under the brain control, and it regulates the heart rate according to the demands of the body. According to the demands of the body. Okay, what do I mean by that? What I mean by that is, like, for example, during exercise. What happens during exercise? Let's talk about this. Yeah. Now remember this, our old equation for respiration. Now this is at the center of the life of any cell or any tissue. Glucose is the source of energy. It reacts with oxygen to give us carbon dioxide and water and energy. Now, when the muscles are contracting, they require lots and lots of energy, especially the cardiac muscles, which are beating all the time. They require a continuous supply of energy. Therefore, when you are exercising, the muscles require energy. The rate of this reaction increases. When the rate of this reaction increases, it is only understandable that the level of carbon dioxide increases. First of all, level of oxygen decreases because the muscles are using it. So the level of oxygen decreases, as a result of which the level of carbon dioxide increases because this reaction is going forward, right? Now, when the level of carbon dioxide in the blood increases, so this is detected by the brain. How? Carbon dioxide reacts with the water in the blood. Carbon dioxide reacts with the water in the blood. Yes, Sadaslam, good job. And it forms a weak acid, which is carbonic acid. Okay, this carbonic acid. This is a balanced equation. So carbonic acid in the blood rises, and carbonic acid, since it is an acid, it basically gives us hydrogen ions and carbonate ions. Okay, it gives us hydrogen ions and carbonate ions. Okay, so these hydrogen ions are responsible for decreasing the pH of the blood. These hydrogen ions decrease the pH of the blood, which is detected. Yes, it is a reversible reaction. That's why this is a weak acid. Remember, we did weak acids. Did I do weak acids with you? No. But you have done it in this came in assessments, acids and alkalis, if you remember. See, remember one thing: chemistry, physics, and biology. These three subjects are interlinked together. In many of the countries, they are now teaching all the three subjects together. They have stopped separating them. So you will see lots and lots of chemistry in biology, and you will even see physics. And I will show you physics in biology, okay? So people who say that, you know, I'm a doctor, I don't know physics and chemistry, I don't want to comment on that. So anyway, so carbonic acid gives us hydrogen ions, and hydrogen ions concentration in the blood decreases the pH, okay? And that fall in pH is detected by the brain, okay? And the brain then sends, I have made a flow diagram for this. Where did it go? I made a flow diagram for this. Where did it go? Oh yeah, here, okay. So exercise causes increase in the level of carbon dioxide in the blood. That, you know, produces carbonic acid, as I just showed you, releasing protons or hydrogen ions. That decreases the pH of the blood. The low pH stimulates the receptor cells in brain. Now, the receptor cells in brain, when they get stimulated, then they stimulate the pacemaker, the sinoatrial node in the walls of the right atrium. Hey, heart, you got to work more. Okay, muscles require more oxygen. More carbon dioxide is getting accumulated in the blood. You need to get rid of it. So in order to remove this carbon dioxide, the respiratory rate increases. The respiratory rate increases. That removes carbon dioxide and brings in more oxygen for the body. But then the increased respiratory rate will only cause increased oxygenation of the blood. But then how will it be transported to the cells? By increased heart rate. Okay, increased heart rate will fasten the circulatory system, and therefore increased blood flow towards the cells, and increased blood flow towards the cells, and therefore increased oxygen supply to meet the demands of the cells, to promote this reaction in the cells. Okay, you get that? Okay. Now, no, pacemakers there's natural pacemaker. The natural pacemaker is a sinoatrial node. But yes, if something goes wrong with that pacemaker or that pacemaker stops working for some reason, then we have the new technology allows for this artificial pacemaker. But it is, of course, it is nothing like the natural pacemaker. It sends electrical impulses at regular rate, regular meaning fixed rate of 1 impulse per second. Okay, 1 impulse per second, meaning that I think, I'm not sure about this. You can life 999 life. You can ask your dad. Can artificial pacemaker adjust to the changing demands of the body? Like for example, in exercise, when the pH decreases, can this increase the heart rate of the can this increase the heart rate in response to decreased pH of the blood? Go and ask your dad, okay? Because even I don't know. Even I don't know, and I did not get time to search it on Google or anywhere else or in the books. So if you can do that for me. Okay, my question is, okay, I'm repeating my question. Okay, I'm repeating my question. See, our book is saying that artificial pacemaker sends electrical impulses at a fixed rate of 1 impulse per second. Okay, but my question is, does this artificial pacemaker change the rate according to the demands of the body? Like for example, in exercise, when the demand of the body increases, the natural pacemaker increases the heart rate. So can artificial pacemaker do that? That is my question. Okay. No, I do not have a picture of an artificial pacemaker, no. An artificial pacemaker lasts for only 10 years. Okay, it lasts for only 10 years. Okay, some of the students are asking for pacemaker explanation again. So, okay, I'm repeating the pacemaker explanation. Don't be confused or scared by these complex terms. Pacemaker is just a specialized tissue in the walls of the right atrium, okay, and its job is to regulate the heart rate. It is under the brain control, and it regulates the heart rate according to the demands of the body. Okay, according to the demands of the body, meaning that when the demand of the body increases for oxygen or removal of carbon dioxide, then the pacemaker increases the heart rate and therefore ensures increased blood supply as well as oxygen supply to the cells. Okay, that is all a pacemaker is about. So it is a specialized tissue in the walls of the right atrium. Yes, that's what your book says, that we can replace the pacemakers after 10 years. Okay, okay. Now I want you to look at the ECG picture given in your book. You're most welcome, Amna. Let me check the chat window. Okay, what is HR? HR is short form for heart rate. Okay, what is the shape of an artificial pacemaker? Okay, you want to see a picture of an artificial pacemaker? I can Google search it now and show you. Let's see. Okay, artificial pacemaker. Yeah, okay. This is what I got. Am I sharing my screen with you? Okay, wait. Okay, this is what I got. You can do this on your own as well. Just write down artificial pacemaker. This is how an artificial pacemaker is looking like, kept there on the table just like that. But then how does it look when it is implanted into a body? This is how it looks. This is the heart on the left side. They have implanted it this way. Can you see how they have sewn through the vena cava, because you know pacemaker is usually found in the right atrium. Right atrium is the one that is receiving the deoxygenated blood from the vena cava. So they have, I can see that they have sewn the wire of pacemaker along the wall of the vena cava, and it is reaching the wall of the right atrium. That's all I can see. That's all I can show you. Okay. So yeah, I forgot to get an image of this. I didn't know you guys will be interested. Okay. Can I show my exercise notes again? Yes, I can share in the group. Okay. Or I will show, I will share the recording of this class, and so you can have a look at them again. Okay. It should, because the heart rate can increase anytime due to increased anxiety or stress. And if an artificial pacemaker can't meet the body's demands, then it has a serious flaw. Yes, Hania, you are right. But you know, things made by humans, they do have serious flaws all the time. And because the way the book has mentioned that it has a fixed, they did not use the word fixed, they used the word regular heart rate. So I was just wondering, and I did not get time to look upon this. So you guys can go ahead and look for this, and then let me know. Pacemakers work only when needed. If your heartbeat is too slow, the pacemaker sends electrical signals to your heart to correct the beat. Okay. Doesn't pacemaker increase blood pressure as it's taking area? No, no, it's not taking that much area. No, no, it's not within any vessel. Okay, it is outside the vessel. Okay. Okay, now let's talk about the cardiac cycle now. Oh, sorry, ECG. I forgot the ECG. Okay, now what is ECG? Again, it is a short form of electrocardiogram. Okay, I will show you a good picture of it. I took pictures of it. This is the same picture as your book, by the way. Okay, but I can show you in a better way this way. Now, pay attention to the shape of this graph. Okay, you have the P wave, R, Q, S, and T. Now, from P to T is one complete cardiac cycle, from P to T. Now, this is electrical activity through the walls of the heart. This is electrical activity. Okay, these spikes are representing electrical activity. Now, this spike, the big spike, RQS, this is responsible for ventricular contraction. Now, now pay attention to my words. I'm saying it represents ventricular contraction. It is not ventricular contraction itself. Okay, remember, these spikes are representing the electrical activity, meaning that this electrical activity, which is shown by RQS, is responsible for contracting the ventricles. So ventricular contraction will follow shortly after this spike, RQS. Okay. On the other hand, this P, the P bump or the P wave, it's called the P wave, that is representing atrial contraction. Atrial contraction. Now you can appreciate the fact that P wave is preceding the Q wave. Preceding mean coming before it. Okay, Q wave is following the P wave, meaning that Q wave occurs after the P wave. So that means, because P is representing the atrial contraction, that means the atria contract before the ventricles, right? This shows the atria contract before the ventricles. And this makes sense. You know, when the atria will contract, they will squeeze the blood into the ventricles. And then when the ventricles will contract, they will squeeze the blood out through the aorta and pulmonary artery. So that just makes sense, right? Now, what the T wave stands for, no need to know that for now. Okay, leave that. That's complicated. So just understand P wave and then R, Q, and S. Okay. Now, there's a question at the end of this topic in your book of calculating the heart rate using this graph, using this picture. So as you can see that they have given a scale that one big box represents 0.2 seconds. One big box represents 0.2 seconds. So using this scale, you can calculate the time interval between two consecutive contractions, two consecutive ventricular contractions, okay? So, and then you can use the ratio method that if one cycle is this much long, is this seconds long, then 1 second would have how many cycles? And that's how you can, by the ratio method, you can calculate the heart rate. By the way, we will solve that question, so it will get clearer when we do that question. But this graph also helps us in calculating the heart rate of a person, okay? And it also tells us how healthy the heart is working, or if the heart is working okay or not, right? So that was about ECG. Okay, let me get back to you guys. Any questions for me? Let me see. Okay. ECG is also called EKG. I don't know. I am not sure. I'm not sure. I can find out. Okay, what if the pacemaker is not replaced in time? Well, then, you know, that's bad. The person will have complications, will have problems. Okay, sphygmomanometer. I cannot remember. I have heard this name. Where do you guys come with all these questions? Where do you bring all these questions from? You guys are so good at asking questions. You know, I don't know what this is, sphygmomanometer. I have heard this term, but I don't remember. Okay, you go find out and then you let me know. Okay, now let's move on. Cardiac cycle. Okay. Now, before we study the cardiac cycle, simple terms so that it is easy. Systole and diastole. Okay, systole refers to that part of the cardiac cycle when it contracts. Oh, sphygmomanometer is mentioned on page 113. Why didn't I come across it? Where is it? Oh, yes, now I know. Oh, okay. Oh, see, now I remembered. This is a sphygmomanometer in this picture. Blood pressure apparatus, this 114, with the help of which this doctor is measuring the blood pressure of this patient. A sphygmomanometer being used. Yes, I totally slipped my mind. Can the labeling come for the ECG graph in the exam? They haven't talked about ECG that much. I don't know. This ventricular contraction and atrial contraction also was not mentioned in the book. I told you on my own. So I don't know if this will be, we will do past papers, we'll find out. Okay, but I don't think so. They might ask you to calculate the heart rate from this ECG graph. Yeah, that's the type of question I might expect. Okay, now, so coming back to this cardiac cycle. Okay, systole is the contraction part of the cardiac cycle where the blood is squeezed out of the heart. Okay, diastole is the relaxation of the heart. Okay, when the blood enters into the heart. Now remember, both the atria almost always, I mean, they receive the blood together. And then both the ventricles almost always squeeze the blood together. Okay, look at this. Okay, so we will go through this diagram. Okay, but before doing that, let me, oh, we have done the valves, right? I don't need to do this again. Okay, by the way, somebody was asking what is the difference between bicuspid and tricuspid? Okay, bicuspid and tricuspid is because bicuspid, mitral is, by the way, bicuspid. Can you see this? Bicuspid meaning it has two flaps of tissues. Tricuspid has three flaps of tissues. Okay, that's why they're called tricuspid and bicuspid. Now, if you ask me why the mitral valve is bicuspid and why the the tricuspid is made up of three tissues, again, I will have to find out. Okay. Okay. Yeah, maybe. Okay, function of tendons. Okay, who will tell me the function of tendons? Come on, come on, come on. You guys know it. Function of tendons. Could you say what point represents what on the ECG graph? Haya, I said that the P wave represents, it is the electrical activity, it is not the actual contraction, but P wave represents atrial contraction, atrial systole, atrial contraction. You know, systole is contraction, okay? So atrial contraction will immediately follow the P wave, okay? Whereas the ventricular contraction will immediately follow the RQS. Okay, so RQS is representing ventricular contraction and P wave is representing the atrial contraction. Okay. Yes, Samia, good job. The valves stop the blood from, no, not the valves, tendons, tendons. Yes, Hania, yes, tendons stop the valves from going up too far. Okay, what will happen if the valves go too far? If the valves go up too far, then what will happen? What will happen if the valves go up too far? Yes. What will happen if the valves, oh, sorry about that. So, okay, my pathetic drawing, okay, but I have no other option, so I'm just, bear with me, okay. These are the valves, okay. For just imagine that this is a heart, okay. Now these are tendons, okay. These are tendons. Now when the ventricle, if the ventricle is contracting, okay, if for example this is the ventricle, this is the ventricle. Now when it contracts, it just squeezes, right? Now, if it is squeezing, and remember, the fluid flows from region of high pressure to a region of low pressure. We did this, we have done this already, okay? Fluid always flows from a region of high pressure to a region of low pressure, okay? So if the ventricles contract, the pressure within the ventricles increase. And when the pressure within the ventricles increase, the blood, for example, this is the aorta, okay? So when the ventricles contract, the blood should go this way. The blood should go this way, but it might go this way as well, okay? Because here the pressure is low. Pressure during, because when the ventricles contract, atria relax. When the ventricles contract, atria relax. So if the atria relax, the pressure in the atria will decrease, and then the fluid is tempted to go from high pressure. Here the pressure is high, because it's contracting, so the pressure is high, so the blood tends to go back into the atria because here the pressure is low. So these valves, they shut. No, you're not allowed to go this way, that way only, okay? So now if these tendons were not there, these tendons which are anchoring the valves to the walls of the heart, if these anchors were not there, then what would happen is this. These would open this way. This is what they mean by going up too far. So I'm sorry, excuse my drawing. The blood should go this way, right? But if the tendons were not there, I'm just saying, just imagine if the tendons are not there, the blood would push these valves up, and then the valves would turn the other way around, and then the blood would be able to re-enter the atria, which is not needed. I mean, which is not wanted, which is unwanted. Okay, tendons, Yusra, tendons are anchors which are anchoring the valves to the walls of the heart. Okay, they are tissues. I showed you the picture. I'll show you again. Okay, I'll show you again. So I'm just emphasizing on the importance of tendons. So they will open the other way into the atria, and then the blood would be able to enter back into the atria, which is dangerous. Okay, so we don't want that. So the tendons pull them in their, push the, the tendons anchor them to their place, so that they do not move, the other way around into the atria. Okay, I hope you got my point. I was, I searched for any animated video showing me the importance of tendon, but I could not find any. So I had to resort to my pathetic drawing. Okay, okay, okay. I will, do you guys have any? Okay, let me just finish this real quick. Cardiac cycle, okay, because I am short of time. I have to finish this class sharp at 7:15. Okay, let me share my screen again. Okay, I am showing you the same picture which is already in your book. Here. Now, this part of this picture, this is figure 9.11 on page 113. Now, this is showing us atrial diastole. Atrial diastole. Now, diastole, I've already introduced this term. It means relaxation of the atria. So when the atria relax, now remember, any chamber which is relaxing, meaning its volume is increasing. And when the volume is increasing, pressure is decreasing. Okay, pressure is decreasing. So fluid flows from a region of high pressure to a region of low pressure. So when the atria relaxes, its volume increases, pressure falls, pressure decreases, and therefore the blood can easily enter into the atria via the vena cava into the right atrium and the pulmonary vein in case of left atrium. Now both the atria relax together, almost together, okay? Now the atrioventricular valves open, of course, because they open downwards and they have to let the blood enter into the ventricles, right? And so this oxygen, this blood, both oxygenated and deoxygenated, they enter into their respective ventricles, okay? Now, the next stage is the filling of the ventricles, okay? Now here they are calling this atrial systole, meaning first they got filled with blood, now they are squeezing to squirt all that blood into the ventricles. Now the ventricles are filling and the atria are emptying. They are emptying their content into the ventricles, okay? Their blood into the ventricles. So the ventricles will expand a little because they are getting filled by blood, okay? So this is called atrial systole. You can even call this ventricular diastole because I think the ventricles are also getting filled, so they're expanding, right? Now in this, atrioventricular valves will open, the semilunar valves will close. Why the semilunar valves will close? Because as you can see, the ventricles are expanding. Now, if the ventricles are expanding, the pressure is low, so there might be backward flow of blood or drop of blood via or through the aorta and the pulmonary artery. We don't want that happening. We don't want that happening. So the semilunar valves shut. They shut under the pressure of the blood. If it tries to fall back, that pressure of the incoming blood will shut the valves, okay? Subhanallah, you know, Allah has made such an amazing, this amazing organ. So that's why these semilunar valves shut and the ventricles get filled with blood. So this can also be called ventricular diastole or atrial systole, okay? Now, next is when the ventricles are squeezing, they're contracting. As you can see, the volume within the ventricles has dropped, okay? So again, the fluid will move from a region of high pressure to low pressure. So when the ventricles are squeezed, they contract, the pressure inside the ventricles increases, and so squirting the blood out through the pulmonary aorta, pulmonary artery and the aorta, okay? And now the atrioventricular valves have shut. Now tendons, can you see, Samia, the tendons? You were asking me. The tendons are these lines they have shown in this diagram, the lines which are connecting the valves to the walls of the heart. Okay, I will show you another picture. Okay, okay, Samia, for you, because you asked me the tendons. There was a picture I showed you. There was a picture I showed you. Am I sharing my screen? Okay, here, this silver white wire-like structures which are connecting the valves with the walls of the heart. Here you can see it, you know, can you see? Valve is connected to the walls of the heart, okay? These are tendons, the white structures. Yes, this white structure, this. I'm talking about this, okay? This. The plain white stuff at the top is a valve. The string-like network at the bottom are the tendons. The string-like network at the bottom are the tendons The plain white tissue at the top is the valve. Okay, this is what I mean. Okay, so I have done cardiac valves. Okay, I gathered a few nice pictures for you guys to show you guys, and I totally forgot to show them to you when I was discussing those topics. So this is the time I'm showing you real quick. Now, this is how, when a vessel wall is damaged, how the blood flow is disturbed. You know, can you see on the left hand side, the flow of the fluid is real smooth. Okay, the flow, because the wall is smooth of the vessel, and so the blood flow is smooth. This is actually water, but the blood behaves the same way. So I got this picture. Okay, yeah, this is physics, by the way. By the way, this is fluid physics. So I told you I'll show you physics and biology. This is physics, okay? So you can see that when the walls of the vessels are smooth, the fluid, the blood will flow smoothly, and so the blood pressure would be normal. Now, when the blood vessel gets rough or bumpy due to, for example, the plaque deposition, this is how the blood flow is affected. It is no longer smooth, but it is turbulent. Turbulent means there is disturbance in the flow of blood, and that will further damage the cells lining the vessels. Further damaging the cells lining the vessels. So it's like a vicious circle. So first you got a bump that disturbed the blood flow. That disturbed blood flow further damage the endothelial, the cells that are lining the blood vessels, and that will cause clot formation, because platelets will detect that there is some problem here. We need to make a blood clot. So they aggregate and they make a blood clot, and therefore you get the vessel blocked. This is another picture I got, the difference between smooth flow of a fluid and a turbulent flow. Smooth flow when each layer is at its place, okay? Turbulent is when the layers get bumped into each other, okay? And they, okay, this was one picture I got for you. Was there any other picture I wanted to show you? Wait. Yeah, this was a really good GIF for the cardiac cycle. So you can see the blood entering from the atrium through the ventricle, and then from the ventricle into the pulmonary vein and the aorta. Can you see? I liked it a lot. So first the atria are expanding, getting filled, squeezing, and then the ventricles are expanding, and the ventricles are squeezing the blood out through the semilunar valves into the respective vessels. Okay, so I liked it. Wanted to share with you guys. And so that's that. Okay, so I know you guys must have loads and loads of questions for me. Let me check the chat window. Okay, what are these parts? These parts are flaps. Juice World, 999, bicuspid valve and tricuspid valve. I just showed you the flaps. Yes, the class has ended. Yes, step bro, Waleed. Yes, the class has ended. Okay. Okay, so I need to end this class now. Okay, Jazakallahu khairan. I am unmuting all of you. You guys understand my class today, or was I?
Yes. Miss 999 live send you the answer. You did not see it.
Okay. Okay then. Assalamu alaikum wa rahmatullahi wa barakatuhu.